Good evening, ladies and gentlemen. My name is Huang. I'm studying epidemiology at the Institute of Public Health. I'm also a physician specializing in endocrinology and metabolism. Most of the time, I treat patients with diabetes mellitus. And my study idea was inspired by my daily clinical practice. In the next few minutes, I would like to share with you the research for my master's degree: diabetic kidney disease, risk factors, and prevention. If I ask you, are you afraid of having COVID-19? I believe nearly everyone will say yes. Otherwise, we'll be competing in the hall instead of this virtual conference. But what if I ask you, are you afraid of having diabetes mellitus? Well, the answer may not be so sure. You may start wondering what makes such a difference. According to the International Diabetes Federation, there are 537 million people suffering from diabetes worldwide in 2021, and the number is expected to rise to nearly 800 million. In Taiwan, about 2 million people have diabetes. The number is far more than the number of people being diagnosed of having COVID-19. But we still fear COVID-19 more than we fear diabetes. Why? The answer is quite simple. Because human brains are evolved to focus on immediate danger, such as COVID-19, which may take life away in a short period of time. By contrast, diabetes mellitus is regarded as a chronic illness, and the impact is usually overlooked. However, our ignorance may cost us a huge price. So what exactly is diabetes mellitus? The word is derived from both Greek and Latin, meaning a large quantity of sweet fluid passing through human body. And in Mandarin, it is translated as a sweet urine disease. How I wish diabetes is as benign as its name implies. Unfortunately, that is not the case. Glucose is an essential nutrient for life, and human body has a fine tune to maintain blood glucose within a certain range. When that regulation fails, human body will be damaged after soaking in highly concentrated glucose for a prolonged period. Because glucose is present everywhere in our body, the damage is extensive and no organ is spared. Some organs, such as eyes, kidneys, brain, heart, or nerves, are more vulnerable than other organs to develop chronic complications. And these complications will eventually kill us after many years of torture. Among all the chronic complications, diabetic kidney disease is probably the most dreadful one. According to the Health Insurance Bureau, diabetic kidney disease is the top one healthcare expenditure in Taiwan, followed by diabetes. And since diabetes is the leading cause for chronic kidney disease, we can say that diabetes accounts for the top two healthcare expenditure in Taiwan. The negative impact of diabetes on our health economics may be worse than we previously thought. Needless to say, how to save kidneys from such sweet poison becomes an urgent issue. From the standpoint of public health, prevention is always better than cure. So the first step is to prevent the development of diabetes. And for those already having diabetes, our priority falls on preventing subsequent complications. So finding and eliminating the risk factors for developing diabetic kidney disease plays a crucial role to win this war. This is why I conducted such research for my master's degree. After all, a kidney saved is a kidney earned. The last slide shows some preliminary results from a hospital-based data analysis. Here are some risk factors for diabetic kidney disease, and I hope I will have the chance to discover more in the future and share with you some positive results. Thank you.